Hello, Franklin County. My name is Scott Levine, and I'm your County Health Director. And while I've met many of you, I'm sorry many of us have not had a chance to meet before now. And I hope someday when this pandemic is over that we could share some conversations at the health department, local restaurant, the store, or at a county commissioners meeting. But we'll have to save that for another day. Today, I have to talk to you about an invader that has come to Franklin County, an invisible enemy that is bent on sickening many, taking the lives of some, detrimentally altering our way of life if we let it. Of course, I'm talking about the virus that causes COVID-19. So if you were hoping and praying the virus would skip by Franklin County, unfortunately, I am here today to let everyone know it's already here. It's been here for at least a few weeks now. And while it probably hasn't hurt anyone you know yet, it will cause harm to someone you do know, and very soon, if we allow it to stay in our county without a fight. While it's clear hearing me speak that I ain't from around here, and I've been here long enough to learn some important things about Franklin County, specifically that family, community, the land, our state, and country are deeply valued. I've also learned that folks from Franklin County fight to protect all they hold dear. And that is encouraging to think about as we move forward into uncharted territory with our current adversary. While the field manuals for handling the war against this pandemic were originally written in 1918, a lot has happened to our country and the world since then. In public health, we've been building on the knowledge of our forefathers over 100 years, and we are learning all we can about our new adversary in 2020, the virus that causes COVID-19. It is said to be successful in war, you must study your enemy and learn all that you can before you engage them in battle. So here's what we know about our enemy today. Because this virus comes from other animal species, as far as we know right now, the only humans on the planet who might have any immunity to this virus are those who have already had it. The virus enters our county, our towns, our homes, and our bodies through airborne transmission from those with the virus who are showing symptoms of the illness, and even from those with the virus who appear well. Someone coughs or sneezes and the virus hangs in the air in water droplets, or it falls to a surface waiting for one of us to invite it into our bodies when we don't wash our hands, we touch our faces, or we breathe it in while visiting too closely with others. Once in our body, about 80% of us will experience only mild or moderate symptoms, and those lucky folks might think it was just a cold or your normal seasonal allergies. You'd be tempted to just soldier on like we often do, toughing it out, but you'd be harboring the enemy and allowing the virus into your job, your home, and your family and friends if we opt to simply carry on when we're sick. Because so many will get the virus but won't recognize it because they'll be showing few or no symptoms, large numbers of people could spread the virus in our county, and 20% of everyone who gets this virus will have severe medical problems, and some of them will die. Today, there is no vaccine, no treatment, no magic pill that will restore our health once exposed to this virus. Prevention and managing symptoms are the only medicines we have today. So here's the Cliff Notes, or for our younger folks, the Spark Notes version on understanding why us public health types are so concerned about this virus. We call this, unfortunately, the bad news. We have no immunity to this virus. It is highly contagious. If we carry on as usual, by this time next year, some 60 to 80% of us will have had this virus. Of those who get the virus, 20% will end up with severe symptoms, and somewhere between 0.66% and 1.5% of everyone who gets the virus will die from it. That is 6 to 15 times greater than the case fatality rate for the flu. So here's the good news. Our governor has implemented executive orders to keep us away from each other whenever possible. And most people in Franklin County are heeding that call for social distance. And to you, I say thank you. When we do run into people at the store or other places, most people in Franklin County are also following the rules about physical distancing, staying 6 feet apart, no gatherings of larger than 10. Our healthcare providers in Franklin County receive and follow current evidence-based virus guidance. We have a large number of the best hospitals in the country right at our doorstep. We have local and county officials actively engaged in planning to address the impact the virus will have as it continues to spread in Franklin County. And we have a list of behaviors we all can adopt that we know can and do work to slow the spread of this virus in Franklin County. And many of us can recite them in our sleep by now. Frequently, you will hear people refer to doctors, nurses, EMS staff, and other healthcare providers as, quote, being on the front line of this battle against COVID-19. Well, I believe they're wrong. The real frontline warriors are you, your family, your friends, your coworkers. This battle will not be won in the emergency room or in the intensive care unit. It will not be won with ventilators or other equipment. It will be won by everyday people doing simple things to slow the spread of the virus in their own homes and towns. If we get everyone in Franklin County to follow the recommendations we know work, a year from now, when we're having a family barbecue or singing in church, and we look at all the people who are still sitting around that table or in those pews in their usual spots, we will know we fought the good fight and we won. So one more time for all of our new Franklin County COVID-19 warriors, follow the stay-at-home orders. Stay out of groups of 10 or more people. Maintain at least 6 feet between you and others. Wash your hands with soap and warm water and use hand sanitizer whenever possible. Don't touch your face. Cough and sneeze into your elbow. When you're sick, stay away from others and call your doctor if your symptoms worsen. Now, battling a foe we can't see by doing many things we really don't want to do, especially while so few people appear to be getting sick right now, is hard work. It requires discipline and faith and loss. As my late father-in-law used to say, if it were easy, everyone would be doing it. So when you're home today, take some time to look around at all the people who are counting on you to do your part. Pull down a family album or pull up a family album online and leaf through those pages. Look through your friends on social media and imagine what it would be like if any of them were not here this time next year and how you'd feel if you knew you could have helped prevent even one of those losses. With a battle plan in place that we know works, we can beat this virus in Franklin County if we have the courage to carry it out. I've been here long enough to know that that courage exists in Franklin County. Stay healthy, stay safe, everyone, and soldier on, my COVID-19 warriors in your homes and your communities. Thank you.